My name is Roger Plotho. I run a little division of a large newspaper company that produces these kinds of events, and this is our 5th annual. And attendance is up about 20% from last year. Thank you. I'll be talking about our sponsors and some other things here in a moment, but the governor has a busy schedule, and so we want to really start right with his remarks, and he's going to do some Q&A. Just so you know, there are microphones in the middle here and here. We are live streaming today to the campus of Idaho State University, and which will also be recorded, and so behave yourselves. So you'll be on YouTube someday. But we do want you to use the microphones to pick up all the audio and every moment of the next 2 days. I'm going to have the great pleasure of introducing Andrew Cosentino, who is the president of St. Alphonsus Regional Medical Center, who is going to introduce our governor. Just one final reminder as we go through the morning: coffee, some continental breakfast, etc., remain available in the room across the hall here. Coffee service will be all day, food till about 9:30 until they change it over for lunch. So Andy, take it away.
Thank you very much. Good morning, everyone. The good people of Idaho elected Brad Little as the state's 33rd governor in November 2018. Governor Little graduated from the University of Idaho in 1977 with a Bachelor of Science in Agribusiness and has worked in the ranching industry for his entire professional life. Brad has a heart for public service. He first served in public office in 2001 when he was selected to fill a Senate vacancy. He was then elected to 4 consecutive terms to the Idaho Senate. During his service as a senator, Brad was elected by his Republican peers during his first full term to serve in party leadership as Majority Caucus Chair. He then served as Idaho's 37th Lieutenant Governor starting in 2009. Brad is committed to making decisions through one lens: the lens of ensuring Idaho's children and grandchildren have the best opportunities to stay in Idaho and for the ones who have left to return. He has advocated his whole life for a limited government. He works to ensure the lightest possible hand of government in the lives of Idaho citizens, and he seeks to build the public's confidence in state government. I'll ask that you all join me in welcoming the governor.
Thank you. Well, good morning. It's nice to be here this morning. It's a bit wet this morning. I was out pretty early and I got drowned, so but it's great. Idaho's a dry state by its nature, and rain is, a friend of mine said, is seldom convenient, but it's always welcome. So that's going to make the state look great. It looks like you've got a great program. I have attended this event in the past, but unfortunately I won't be able to attend it today. But Sarah Stover, who handles healthcare policy, will be here all day. So if there's something that you have an urgent need for me to know, let Sarah know, and she will also let me know. But thank you for participating in this. You heard about what my lens is, that we had a cabinet meeting yesterday, and I continue to emphasize it to my staff and to my cabinet and to the directors that whatever we do, if we can run everything through that lens of creating an environment to where we thrive and then our kids choose to stay here. This is graduation season, and as I talked to graduates, I was in Parma yesterday and was there when they awarded some scholarships to some great, bright, young Parma kids that are going to go off to school. What we do here to bring them back is very important. And some of the issues on a broader scale that are important to me is that, and I think everybody knows that I've been pretty involved in public education. We just appointed our Kids Idaho's Future task force, which is A, important that we educate our kids, but B, those kids that are leaving those students that are leaving, for them to come back, they need to know that we got a good education system for their children. And so that's why that's so important, because education is one way that individuals can best chart their own destiny going forward. Obviously, we have to have great career opportunities, and your industry is one of the fastest growing industries there are in Idaho, and there's a variety of needs that need to be addressed there as far as you finding the workforce you need and having opportunities for these kids. And of course, obviously, I want these kids to have a good opportunity of making not only a living wage, but a wage that they can comfortably plan to retire on. But that doesn't necessarily work if the cost of health care continues to escalate. There was a Gallup poll, I read it in the Wall Street Journal, I think 3 or 4 weeks ago. It was a nationwide poll where they talked about people selecting either A, that their health care costs would be frozen, or B, that their income would go up by, I think the number was 10%. And it was amazing, like 75% of the American public said they'd rather have know that their health care costs were going to be frozen. And I think that is abundantly apparent in the people that I talk to. We all know where we are in Idaho right now with the incredible growth, and of course that creates growth in your industry, in the healthcare industry, particularly as some of us get a little older. I know not everybody's getting older, but I happen to fall into that category. but it is important that we continue to grow the healthcare industry in Idaho to address all these new people that are coming in the state. At Parma yesterday, I said, I got a question about the growth in Idaho, and I said, well, I was going to build a wall, and man, the crowd went crazy. But I was up in Coeur d'Alene, and I was touring Kootenai, the Kootenai Hospital, and they were taking me through the new NICU, and they said, I said, well, you know, those NICU nurses are very, very important. Where are you getting them? He says, they kind of whispered and says, we're getting them from California. And so I thought, if I'm going to build a wall, I have to leave a gate in it for NICU nurses if they come into Idaho. So, but it is amazing what's taken place in the state of Idaho. The just phenomenal growth from one end of the state to the other. And of course, a lot of those are retirees, and they create another demographic that's needs health care, obviously. And that goes to one of my issues, is what do we do in rural Idaho? Retirees, particularly if they have the option, and many of them do, are not going to go to a community that doesn't have a pharmacy or some kind of good health care. So what we do from a state, what you do from an industry, to do that is very important to me for rural Idaho. Obviously, what Idaho State's doing with their Bengal pharmacy, I've been to some communities where that is just incredibly important, that we can get pharmacists out into these rural areas in some kind of a clinic or a satellite to a hospital or whatever it is. And that fosters a growth of the community, but also businesses. If you're let's say you're a small manufacturing company that wants to make components for either the aerospace industry or the rec tech field, any of those areas, for you to get the kind of workers you want, they're going to have health care in those small communities. So I look forward to any recommendations that you'll have on what we can do to do that. Obviously, there's a lot of things going on at the national level. I understood we're expanding Medicaid in Idaho. I don't know where I heard that. I heard it somewhere. But we're going to get that done. And we do have various waivers that we're waiting to hear how that process goes forward. You're going to hear about that from some of your panels today. I think the timing of it, not only the language that was in the initiative, but also what the legislature did, what our Department of Health and Welfare did, to put it out January 1, so the sign up is this fall, to see what that does to our exchange. It gives us time to calculate what waivers are going to be available, what kind of potential gaps we're going to have, what population that we thought were going to be covered are not going to be covered by the expansion. And that was a prudent thing to do. Obviously, a lot of us would like to have those people covered as soon as possible. But this is going to be, from a timing standpoint, I think this is going to be very workable. And I'm supportive of that, of the timeline, just because of how it works with everything else. One of the other executive orders that I have coming up is what we're going to do in the opioid issue. I think that I've seen several drafts of it. We're still working on the drafts, but it is going to be broader than just opioids. You know, some states, I think Massachusetts is 3 days maximum prescription. There's, I think there's 5 and there's 7, and you know, a lot of the research says that you know, certain individuals, a 7-day supply, red lights flash about what's going to take place. But I'm concerned that if we do that, that the unintended consequences, as is often the case with some of these addictions, is heroin or fentanyl or one of those other synthetic drugs that might be out there. So we cannot address the opioid problem in a vacuum. You know, the two fastest growing parts of our state budget over the last recent 20 years history is corrections and Medicaid, and there's a pretty good nexus of substance abuse into both those areas, and we have to get our arms around it. Our pharmacy prescription plan that was put in 2 years ago has actually been quite successful. I wish that, and of course no state did, I wish that we would have done that earlier because a lot of these problems that manifested themselves in corrections and social services and mental health have all been a result of that. One of the other things is I saw yesterday we were getting a grant from the federal government to address it in rural areas. There's a lot of unknowns. There's a lot of balls in the air on this issue because we know we're going to get more money from the federal government. There's a high likelihood, and I don't know how they're going to settle all this litigation that's going on, that there's going to be some revenue there that's going to come into the state. We know with expanding Medicaid, there's going to be revenue there, and I want this task force to kind of make recommendations on how to best deploy those next available dollars to really get our arms around the issue. There's obviously about 4 major components of it. One is, what do you do from an education standpoint to stop this from ever starting and manage it in the early phases? What do you do about people that first start showing the signs of addiction? And then what do you do about people that really got a problem and to take care of that problem going on? Do we use other pharmaceuticals in our correction system to address it? And I'm certain that we will. But it's the whole morass of issues that surround this, plus there's the nexus to mental health and behavioral health investments that we've got to make. So these things all collectively, and with the different revenue streams coming in, and with the commitment from the legislature, and the commitment from myself, are a big part of what we need to do to get the quality of life in Idaho up above where it is. And so that'll be coming out in the not too distant future, and we look to working hand in hand with the healthcare industry on how we can best address that. Obviously, we need to continue on the staffing side to train doctors. This year we've got 19 new residents and fellows, and we've got which is good for the state to have a 10-year plan on graduate medical education and what we do there. Because we know, which is a startling statistic to me, that 70% of those residents elect to stay where they're educated, and that has been a very fruitful program. We just got to get it implemented, and I see Ted's on the schedule for later, so I'm sure you're going to get an update from him. The nursing shortage, I've been through a nursing shortage, through a nursing surplus. It didn't last very long, back to a nursing shortage. But we know with the population growth, with the aging of America and the aging of Idaho, we're going to have to do all we can to address that in almost every part of the state. You're also going to hear from Director Cameron about what I've been very passionate about for the last couple of years, and it's all a result of obviously the unintended consequences of the Affordable Care Act, and that's people that have elected to drop out of health care, of buying insurance. We don't know what that number is. It's, because some of them are in other programs, some of them consider themselves self-insured, but they're probably not really self-insured. But we know it's well over 100,000 people. We've been having, for a year and 3 or 4 months, conversations with CMS. We get close, and then we back up. I see there was a lawsuit on the short-term plans that the administration's been proposing. We passed a bill in the legislature, a real good piece of legislation that will help us in Idaho. But the big deal is we got to get those people covered. Those are the people, the young and the healthy, that need coverage to make the whole system in here work, and we are committed to doing that. And you'll hear an update from Dean later on this afternoon about what's taken place in there. This is really important. Back to my point about rural Idaho, this is really important to the 56% of Idahoans that work for small business. There are so many of those workers that don't have coverage, that are at risk. The businesses and those individuals are at risk if they don't have some kind of coverage if some big catastrophic event occurs. And alongside of our Medicaid expansion, we need to continue to work on that to try and get that number of people with coverage in Idaho up to what we'd all like to see it. Besides the task force on opioids, besides what we're doing in the education field, one of the other things that we'll be announcing in the not too distant future is my children's cabinet. And people ask what's the difference between our kids, Idaho's future, and our children's cabinet. The children's cabinet is a lot more holistic. Nutrition, child health, all those issues to where those kids show up for school and they're prepared from a nutrition standpoint. What do we do in foster care? And that'll have a health component. So the basic message here is almost everything you do is impacting what we're trying to get done as a state. I am incredibly bullish about where the state of Idaho is right now. I don't know what's going to happen at the federal level, but frankly, I think it's prudent for us to just power through it, to just do the right thing for the people of Idaho, do the right thing to get affordable and accessible health care, and whatever happens there happens. I believe that with whatever happens there, and given where we are in Idaho, that we've got, we're going to have 100+ million left over this year. We're forecast to have more than that next year. Given all those things collectively, and the expansion of Medicaid that's taking place, that the number of people that will be covered, and hopefully with some new state-based plans, we'll have more people covered, and it'll just elevate the quality of life for everybody. So with that, Roger, I'll try and answer some questions. Who's got the microphone? Oh, the microphones are set.
Here and here, please use the mics because we're
But if you don't want to be recorded, come up and whisper in my ear.
Good morning, Governor. Stephen Wegg, your Health Idaho. So first, we stand ready to help in anything you're going to do this year to improve health care. To me, the most important thing I heard was your children's task force. We know that education and income are two biggest predictors of good health. If kids aren't ready to learn, they start out behind and stay behind. So a lot of the stuff you talked about is sort of dealing with the after effects of bad health. We need to get in the front end in terms of the front end, and what we can do from kids from pregnancy to kindergarten is probably the most important thing we can do.
Well, I very much agree with that. My corrections folks, I asked, and we've got a bed shortage. There's an article today about that. The board met this week, and I asked them, I says, okay, take a somewhat challenged preschooler at one end and give me the death row inmates on the other, and show me all the on-ramps and off-ramps that there are in life: substance abuse, mental health, nutrition. And that's a big spreadsheet, believe me. But we have to address, people always talk about the next available dollar. It has to be multiple pronged. We can't have effective pardons, parole, and drug courts if we don't have bed space. So we've got to have bed space. But we got to get way ahead of it, just as you alluded to, on what we're doing to prepare those kids and those families to where they're not susceptible to all the bad habits that put them into that system. So, and obviously, education is the most important one. That's why my top priority this year was doubling our investment in literacy, because if those kids can read proficiently by the end of the third grade, a lot of those other problems go away. So, thank you. You guys, it's too early. Was there no caffeine in that coffee? What's the deal? Save the hard questions for the director and for Dean Cameron for later. One more? All right, are you going to let me go? I didn't think so.
Still a journalist, I'm sorry. So Governor, it appears that you're trying to look at all these issues in a holistic, kind of global way. What kinds of things are you doing internally with communicating and organization to make sure that that effort, where I think we can see that you're looking at it that way, gets disseminated down throughout? You've got a lot of bureaucracy and a lot of moving parts. How do you make that happen and send it through the entire organization to address these issues in a more holistic way?
Well, we had a cabinet meeting, part of the cabinet yesterday, and I got to tell you, of course they were going along okay, and then the House and Senate had a little bit of a entanglement at the end of the session, and a lot of the things we were trying to get done got delayed as we were addressing 8,200 pages of rules, and that was a bit of a delay. But I am quite confident that the great people that work for the state of Idaho, that they are focused on that holistic goal. We need to continue to do whatever you do in a good organization, to focus on what's important, and that's obviously the health and welfare is delivering results and measurable results. Perhaps one of my biggest disappointment, which is not a surprise in government, that from a measurability standpoint, we are not where we need to be. But I think every entity of government deals with that. But that's a big part of what we're going to do, is implement measurable, somewhat simple goals, but measurable paths to get there. And perhaps one of the most important things we can do is not penalize people for taking a little bit of risk about making things better. There's some agencies, and I've been around them, where they are very, very adverse to risk. And going back to what I talked about earlier, Roger, is, this healthcare thing is changing so dramatically that we cannot do things the way we always have. We never have. I mean, healthcare's always been a changing dynamic. But we need to continue to, I often tell people I worship at the altar of stealing good ideas from other people, and we need to do that. We need to look at all the other states, all the other programs about what's working and what's not, but we've got to put that into a measurable metrics to where everybody, there's a singular focus in those agencies, and not stovepiped, but from a broad standpoint to where we're getting to that goal of deliverable healthcare results. And that's not easy because, my cabinet members that just were recently in business that are now in state government, an income statement is a pretty simple document. A balance sheet is a pretty simple document. Outcomes from healthcare is a lot more complex than it is versus an income statement or a balance sheet. But we've got some great people in place, and we're going to get there. So, okay, if that's it, I'm going to go off to a land board meeting. Thank you very much. Good luck.